Today is educational kind of session around Polycystic Ovary Syndrome.
Yes, sir.
Great. So who wants to start?
So I understand that you're focused on like diet and you like a nutrition and all that. So what nutrition and like what dietary needs do people with PCOS have?
Yeah, it's a really good question. One thing I'd say, there are certain things which are more specifically good for people with polycystic ovaries. Saying that, the kind of diet they need to follow isn't that different to the kind of diet we recommend to most people anyways. So they can describe as a healthy diet. So what does that look like? So certain things which have some specific benefits. One category of food is called soy isoflavones. So these are what we describe as phytoestrogens. One of Phyto means plant, estrogen is a hormone, the female hormone estrogen. One of the main hallmarks of polycystic ovary is an imbalance between testosterone, the male hormone, and estrogen, the female hormone. So excess testosterone, which can cause the hirsutism, which means excess chin hair. It can cause a bit of balding, male pattern balding at the top, and even the physical profile can start looking, shall we say, a bit more male, which is kind of instead of having the broader hips, you're getting the broader kind of belly. So that's also an androgen design kind of a fat distribution. And so one of the things you want to do through diet is try to increase your natural estrogen. And there are plants which also contain estrogen-like substances. We call them phytoestrogens, or plant-based estrogens. This is primarily soy foods, things like edamame, soybean, tofu, tempeh. These things contain soy isoflavones. Some clients would even take supplements of soy isoflavone. You can get them from Amazon. I have a whole website and links and all that kind of stuff. And so that's one. Another one which is very specific for polycystic ovary would be the kind of food which contain more inositol. For example, for ladies who have trouble with conceiving, they will often take a supplement called myo-inositol or D-chiro-inositol. And the kind of food which contain inositol are things like legumes, so like pulses, lentils. Now, of course, we mentioned soy. Soy is a bean, so lentil, bean, fairly similar. Whole grains as well. So having whole grain bread instead of a normal bread, having brown rice instead of white rice, having more fiber. That kind of brings us to the next one, which is fiber. Because one of the more basic hallmarks of PCOS is insulin resistance, which means your body can't use insulin very well. Your tissues or cells become resistant to the action of insulin, which can lead to higher insulin spikes and higher sugar spikes. Now, fiber does the opposite of all of that. Fiber will kind of reduce your absorption of sugar, absorption of cholesterol. It will help you lose weight. And so increasing fiber, particularly soluble fiber, is really important. And so we often will give our clients targets, try to get to, the average American has something like 12 grams of fiber per day. You would want to aim for anything from 20 grams to 40 grams of fiber per day, but you got to really increase gradually because you can't get bloating and flatulence, that kind of thing, if you just ramp up your fiber intake all of a sudden. So things which contain more soluble fiber, things like whole oats or even rolled oats. So oats would be a better option than cereal, for example. Things like beans, lentils, sweet potato, all of these kind of healthy foods. Most fruits and vegetables are good sources of fiber. One more nutrient which is anti-inflammatory, because again, one of the main hallmarks of polycystic ovaries is inflammation, is omega-3. So omega-3 fatty acids, these are anti-inflammatory. And so things like fatty fish, salmon, and then of course there are various types of omega-3, EPA, DHA, ALA. EPA, DHA is primarily fatty fish. You can also get it from algae. So Supplements, people who are vegan, who won't have a fish oil supplement, will get a algae based supplement. The fish actually get omega-3 from the algae. So the algae are what produce the omega-3. The fish consume the algae and store omega-3 in their fat. Otherwise, you can also get ALA, which is alpha linoleic acid, from things like avocados and chia seeds, hemp seeds, pumpkin seeds, olives, olive oil. You gotta be a bit careful with olive oil because it's very calorie dense. So one of the things we want to do with PCOS is try to get into a calorific deficit and lose weight. And so, although olives are good for you and olive oil is good for you, if you're having excessive amounts of olive oil, remember 1 spoon of olive oil is about 125 calories. If you're like just completely drowning your salad in olive oil, you could end up with a calorific excess and you could end up gaining weight and making the condition worse. So you do have to be careful with the more calorie dense foods. And just generally having a healthy diet. So if someone's having sugar spikes, perhaps they're already becoming pre-diabetic, then in addition to a high fiber diet, we would ask them to increase their protein intake as well, because increasing fiber and increasing protein is the sure shot way of trying to get on top of your sugar spikes. But you really want to focus on healthier forms of protein rather than just blindly just following protein. So plant proteins would be very healthy because they contain both protein as well as fiber, and they don't contain saturated fats. So plant proteins would be, again, soy, lentils, legumes, tofu. Even brown rice contains some plant protein, for example. Quinoa is a good source of plant protein with fiber as well. Other ways of getting healthy proteins would be fish, of course, because it contains omega-3 as well as protein. Something like chicken, turkey, duck, which is white meats, are fairly neutral. If you're getting from KFC or Popeyes, it's deep fried, it's probably not very healthy. It becomes very calorie dense. And when you deep fry and fry something multiple times, you break the covalent, carbon bonds, and you end up making it hydrogenated, so there's no difference between oil and butter if you're deep frying it multiple times. So chicken, duck, turkey are neutral. If it's from Popeyes and McDonald's, not very good. If it's a shawarma or something like that, grilled, excellent. And then red meats, things like beef, lamb, goat, pork, you probably want to minimize just for treats once in a while because it contains a lot of saturated fat. And if anyone's interested in how red meat can cause cancer and how red meat can cause inflammation, you can check out my website, healthgroupcoaching.com. I have a whole blog. I have written about 65 blogs. One of the blog is about how 5 ways in which red meats, mammalian meats specifically, can cause inflammation and cancer. Also, when it comes to dairy products, dairy is very useful. It contains calcium, contains protein. Ladies with PCOS may particularly want to consider soy milk instead, because we talked about soy isoflavones, so you're going to get some extra soy from that. Plus, nut milk contains fiber, while a cow's milk does not contain fiber. So that's the extra benefit. Plus, cow's milk contains saturated fat, while soy or nut milk doesn't. So again, the third benefit. Otherwise, if you're having dairy, and of course there's so many really healthy dairies, things like cottage cheese generally, you generally want to have the lowest fat version. So it's something like mozzarella cheese or 0% unflavored Greek yogurt. That'll have the best ratio of protein to calories. And I have a coaching program for this as well, but what I teach my clients is looking at food labels, and there are 2 particular things I like them to look at. Well, 3 things really. One is fiber to carb content, and if anyone wants to take notes, go ahead, take notes. I describe it as excellent, average, or excellent, medium, and kind of average. That would be a 1:6 ratio, 1:8 ratio, 1:10 ratio of fiber to total carbs. So as an example, I don't know, am I going on for too long, Sanvi, or are you okay with me This
No, this is good. This is good.
okay, great. I have a before I got here, I did a 1 hour coaching session with 10 people, and I do have a I'm I'm rather passionate about this topic, so I just keep going on and on. So
No,
just
it's
let me
fine.
know when you want me to stop, okay?
No, you can go on. Like
Yeah.
this is why we're here. So.
Yeah, so fiber to total carbs. As an example, I get my food from standard supermarkets, and I use this standard supermarket bread called Country Harvest Flaxen Quinoa. That's the one I get. Why? Because it's got 6 grams of fiber and it's got 36 grams of total carbs. That's a 1 to 6 ratio. That's excellent. That's really good. If you 9 out of 10 of those breads would not have that kind of ratio. But then 1 to 8 is acceptable, 1 to 10 is acceptable. But if it's going beyond that, that's a high sugar food. The other kind of metric I like people to look at is protein to calorie ratio. Again, you can have the excellent, the medium, and acceptable. Excellent would be something like a 10%, 1 in 10 ratio of protein to calories. But you could get up to like 1 in 12 to 1 to 14, something like that. And that would be quite acceptable. Often what happens is the foods which have other good nutrients, like fiber, for example, will have a lesser protein to calorie ratio, but they're still very good foods because they also contain not just protein, but also fiber or omega-3, for example. And the third metric I like people to look at is calorie to volume ratio. So as an example, if a food within 100 grams of volume contains less than 200 calories, then that's a fairly good calorie to volume ratio. And if it's the further up it goes, the more calories you have for the volume. The problem with that is because it'll be less satiating, because the more volume a food has, the more space it's going to take up in your stomach and make you feel full. I'll give you a quick example. Let's say you're trying to create a healthy plate for someone with polycystic ovaries. So you get some tofu, really nice healthy source of protein with fiber as well. You also get, let's say, some salmon. Again, you're getting some omega-3 and some more protein in there. You get some quinoa. Again, you've got some fiber and you've got some protein in there as well. Then you get some, let's say, 0% Greek yogurt. You add to the Greek yogurt, let's say, some blueberries or raspberries. That's the one food constituent I forgot to talk to you about, anti-inflammatory agents. And there are primarily the two most powerful anti-inflammatory agents. Anti-inflammatories are always colored. They always have color. Okay? And there are various foods which contain anti-inflammatory agents. The red color could be lycopene. The red color could be quercetin. The purple color could be anthocyanins. The orange color could be beta-carotene. These are all anti-inflammatories. They reduce cancer, they reduce inflammation, they reduce disease. Now, when you look at the vegetable stall at the supermarket, so the squash and the pumpkin and the orange bell peppers, those have beta-carotene, that gives them the orange color. The eggplant and the purple cabbage, that's got the anthocyanin, and the blueberries, and the tomatoes have lycopene, and the raspberries have quercetin, the red apples have quercetin. So all of those colors, and that's why we say eat your food like a rainbow. You want various colors because those are all healthy anti-inflammatory compounds. The other thing which has color would be spices. So turmeric and black pepper, ginger and garlic. So ginger, garlic contain allicin, for example. These are all anti-inflammatory compounds. And so increasing color on your plate. So we were talking about that plate. So you started off with you had some quinoa, you had some salmon, you had some tofu, you had some 0% Greek yogurt with blueberries mixed in, perhaps throw in some chia seeds on top of that, And so that would be kind of a healthy plate. You would have, in the nutrition world, someone like me, if you follow me on TikTok, I've got about 20,000 followers, which is literally nothing. But you look at people spreading misinformation like keto diets and all these kinds of crazy carnivore diets, these people have like 15 million followers, you know. And the sad thing about nutrition information is the false information travels real fast. But if you just try to give people the scientific facts, it's kind of boring, you know, and people don't get really excited about it. So a good balanced diet, a good balanced plate, primarily whole foods, staying away mostly from ultra processed foods, factory made foods, very calorie dense foods, foods which have a high amount of saturated fat, which is mostly ultra processed food which contain palm oil, coconut oil, also red meats, deep fried foods, high fat dairy products. Now, of course, high fat dairy actually helps if you're growing. As a growing person, there is good evidence that if you eat a lot of high fat dairy, it actually increases your height because dairy also contains growth hormones, insulin like growth factors, etc. But once you get to a certain age, like 25 or so, or maybe 20, you don't really have to have high fat dairy. You can move to low fat dairy. You can move from something like cow's milk to soy milk. And someone with PCOS might as well move earlier because of the benefits, the soy isoflavones, the fiber, lactosaturated fat. But that's essentially how you can build a healthy plate. That kind of plate will give you more nutrition. It'll give you more fiber, more protein. It'll give you more satiety. You'll feel full. And that entire plate might be something like 550 or 600 calories. And you'll feel full for at least 6 to 8 hours. Now, compare that to one cookie from Costco, one of those big cookies, that's 850 calories. It will give you no nutrition, no fiber, no nutrients, no protein, no satiety, and it'll give you more calories. Compare that to a poutine from Costco, which is 2000 calories. Again, it'll give you no nutrition, no fiber, a bit of protein in the cheese, I guess, a lot of saturated fat. It'll give you no fullness, it'll give you no nutrition, and you'll be on your way gaining more weight, and the condition underlying becomes worse. One thing I'd like to add to what my wife, Dr. Jyoti, was just saying, PCOS belongs to a family of conditions. The only difference being it is exclusive to females because it affects the female organs. Otherwise, other conditions like metabolic syndrome, high triglycerides, low HDL, prehypertension, prediabetes, fatty liver, they all belong to the same kind of constellation of problems. And this is essentially caused because of chronic calorie excess leading to weight gain in most cases. Even if the weight is not up, generally these clients will have increased visceral fat, which means fat inside the belly, in the organs, in the liver, etc., hidden fat around the belly. And these will be clients who have a genetic predisposition. You can't get the condition without having the genes for the condition. So the friend of a person with PCOS could be twice their weight but not have PCOS because they don't have the genetic susceptibility. And so we often say the genetics, the genes, they load the gun and the lifestyle pulls the trigger. So we can't change genes, but we can try our best on the lifestyle.
What might like a daily diet look like for a person who's trying to like combat the symptoms of PCOS?
Yeah, so there are actually two parts to this kind of diet, and this is like something I like to say to my clients. You can actually become unhealthy eating healthy food. You can also become healthy eating unhealthy food. So one of the most common misconceptions I see in nutrition is that the quality of nutrition is the be all and end all. Now you might think I'm kind of contradicting myself. I was just talking about healthy food a minute ago. What I mean to say is a handful of nuts can be 500 calories. 3 spoons of olive oil can be about 400 calories. If every time you get stressed, you're having a whole lot of nuts and you're having your Greek salad with a whole lot of olive oil, you could end up gaining weight and the condition becomes worse. Equally, there was a professor who wanted to prove this point, he went on the McDonald's diet. But it was a low-calorie McDonald's diet. Every time he'd go in, he'd cut the burger in half. He'd cut everything down in half. He was having a 1,600 calorie meal, but he was cutting it in half. So he was having 800 calories for lunch, 800 calories for dinner, which is 1,600 calories. And he'd have a bit of vegetable or whatever on top of that, 50 calories more perhaps. He was in a calorific deficit. He did it for about 2 months. McDonald's diet. He lost weight. His blood pressure got better. His cholesterol got better. Everything got better. So you can get unhealthy on a healthy diet. You can become healthy on an unhealthy diet. We need to think about food quality. Very important. I'll be the last person to deny that. I mean, I did a nutrition certification from Harvard. But you can also become healthy on an unhealthy diet and vice versa, because calories are really what decide whether you gain or lose weight. And so you do have to be mindful. I don't want to give people the impression that calories are everything, but not being aware of calories, not understanding that a spoon of mayonnaise is 125 calories, a spoon of zero sugar tomato ketchup is 5 calories, mustard is 5 calories, soy sauce is 5 calories, low-fat mayonnaise is about 35 calories, Greek, I don't know how, is it tzatziki or zaki, whatever, I'm not sure if the T is silent or not. That kind of spread will be about 25 calories per spoon. If you know the common calorie mistakes that people make, then you can avoid making those mistakes. And because I've been coaching clients for years now on my health coaching program, I see so many people who eat perfect 99% of the time, but it's that those 1% of the time when they make those high calorie mistakes messes up their whole progress. So you do need to be aware of calories. You need to know what you're putting inside you from a calorific point of view. Otherwise, you could be in a situation where you're eating extremely healthy but not losing weight.
I have a question. Oh, wait, never mind. My bad.
How many calories should one with PCOS be eating or intaking a day?
Yeah. So the easiest way to go about it is download an app. The common ones are Chronometer, MyFitnessPal. I prefer apps like Snap Calorie and Cal.ai, because you can just take a picture of your food and it'll give you the calorific estimation. These are not the most accurate apps, but it doesn't really matter so much. We're not trying to become bodybuilders or physique models. We don't have to measure every last calorie. You need to have a ballpark figure, or you need to have a ballpark idea of where you are. So even the picture taking apps like Cal.ai and Snap Calorie are good enough in my book. The app will tell you what your BMR is, your basal metabolic rate, which is how many calories you need to consume to not lose or gain weight. So that'll be based upon your age, your activity levels, and also your height. And then to lose about a pound or half a kilogram of weight, or rather fat, you need to be in a calorific deficit of about 3,500 calories per week, which averaging over 7 days is about 500 calories per day. So if your BMR turns out to be 1,900 calories, the app will often advise you consume something like 1,400 calories, 500 calories less to be in that. Saying that, the app doesn't really know what your lifestyle is like. So what you really need to do is you can take the app's word for it and just try to follow that diet, or rather that calorie target. But if you don't lose weight, it's not because you're doing something wrong. You're not losing weight because you're not in a calorific deficit. The app got it wrong. The app over-calculated your calories, so you got to reduce it even further. So remember, it's an estimation. The app doesn't really know what you're doing, but it's a good way of starting off. You got to start off somewhere, so you can use these apps for that.
One question I have is that if you're like on a trip or a vacation and you're going to eat something from outside, what restaurants would you recommend to look for?
Yeah. So Personally, I tend to use the Chipotle types or the Greek or Mediterranean type restaurants. So, like a chicken shawarma or a chicken shawarma wrap, or I try to choose white meats and fish and seafood over red meats for sure. So I try to make that distinction. Also, I try to always try to, if you can just get grilled protein rather than like deep fried, you're gonna just see a whole lot of benefit. I mean, it's very simple. You're gonna have a protein source, you're gonna have a carb source. Make the carb source as whole as possible. So if you can get the option of quinoa or brown rice at Chipotle, for example, that would be a better option than white rice or just white flour based, whatever, white tortillas. So having like at my supermarket, I even get this high protein tortilla. It's got a good amount of fiber and protein in the tortilla wrap. So you can actually start looking at food labels and try to choose something which is, more in line with what you're trying to achieve. And so you're just looking for a good protein source, which is not red, which is not deep fried, which is a kind of grilled white or seafood based or a plant based protein. You're looking for a carb source, which is more whole, so more brown, less white. And then you're looking for some fermented foods as well for your gut microbiome and your gut brain axis. So some yogurt or maybe some sauerkraut or some, miso, tempeh, something like on those lines. And then you're also looking for some healthy fats, so you can stick in a bit of olives or avocado or some seeds and nuts, or maybe a bit of olive oil or something on those lines. And you're getting some with the fish anyways if you chose fish as your protein source. And so that's generally how you would create a healthy plate. And whatever fast food joint is giving you those kinds of options, which typically tend to be your Mediterranean, like Jimmy the Greek, those Mediterranean style, Greek food style restaurants tend to give you most of those kinds of options, I find.
I have a question. So, some symptoms that women with PCOS experience often are acne, oily skin, and hair loss on the scalp. What are some foods that you would recommend to combat those symptoms?
Yeah, that's a really good question. So again, trying to increase estrogen, that would be soy isoflavones. That would be primarily soy, soybeans, edamame, tempeh, miso. Also trying to reduce, also using food which contain myo-inositol and chiro-inositol, D-chiro-inositol. That is things like lentils, legumes, beans, and whole grains, including food which reduce inflammation. So that would be the colors we talked about, fruits and vegetables of all kinds of colors, and spices with all kinds of colors. And then you're trying to reduce inflammation through omega-3 as well. So again, fish, olives, avocado, seeds, and nuts. And that's primarily it. That's more or less it. Of course, there are effective medications which can help. These are usually anti-androgen medications. So there's one called spironolactone, for example, which can reduce hair growth on the face and reduce balding of the head. And if any of you want to check out my website, healthgroupcoaching.com, I have a blog on hair loss and I have a blog on PCOS, and I also have a blog specifically for male type baldness for women. But yet, the kind of approach I recommend is thinking of it like your lawn, growing grass on your lawn. If you're trying to grow more grass on your lawn, you need 4 things, rather 5 things. You need more water, you need more sunlight, you need more nutrition in the soil, you need absence of disease, and you need a good overall environment. So that's the 5 things you need to grow grass on your lawn. What are the scalp, you could say, kind of the analogous kinds of things for the scalp? The first one was sunlight. So infrared light, red light hats, red light therapy is actually quite effective for stimulating collagen and hair growth. The second one was water. So that would be increasing blood supply to the scalp, and that's medications like minoxidil, which is a vasodilator. You can also get Rogaine, which is over the counter. It's just applied on the scalp to increase blood supply. The third was nutrition. So ensuring that you have adequate nutrition, good amounts of protein and all that other stuff we talked about, but also you could consider collagen supplements, hyaluronic acid supplements, protein supplements. There's even soy protein supplements women with hair loss, male pattern baldness could consider because it contains protein but also contains soy. The fourth one was absence of disease. So if you have dandruff, seborrheic dermatitis or something like that, you can use Nizoral, ketoconazole type shampoos. And there is some evidence independently for improving hair growth with ketoconazole Nizoral shampoo as well. And the fifth one was the overall environment, which means if you're trying to grow grass in the desert, it might be very difficult. It doesn't matter. If you get the first four things right, so that is your hormonal environment, your overall diet, your genetics. If you have a super strong genetic tendency towards hair loss, every male in your family becomes bald by the time they're 30. Chances all of these things will help you are very low. The overall hormonal environment, genetic environment is very poor. But yeah, you can do certain things. Becoming healthier generally helps. In the case of women, it is this chicken and egg situation, because we know very well that being insulin resistant makes it more difficult to lose weight. Other studies done, for example, on the weight loss drugs, Ozempic, Wegovy, Mounjaro, Zepbound. I'll give an example. When these drugs were given to normal people like Ozempic and Wegovy, they led to about a 16% weight loss. But for diabetics and people with insulin resistance, it was more like 8 to 10%. So the same drug in someone who is not insulin resistant will give you almost double the amount of weight loss. So we know it is more difficult to lose weight when you're insulin resistant. The reasons for this are multifold. It could be the gut microbiome, it could be other hormonal signals. We know insulin is a fat storage hormone, so when insulin levels are high, you lock in more of your fat, you don't burn your fats as readily. You'd rather become fatigued and not use the energy than burn the fat. And so there are various things why insulin resistance leads to weight gain. So those clients gain weight. However, what happens with belly fat in females, belly fat independently also increases their testosterone and reduces their estrogen. And so it becomes that chicken and egg situation, or rather that snowballing effect, or rather you can call it a vicious cycle, where one problem makes the other worse and the other problem makes the first problem worse. The situations keep getting worse and worse over time. And so it's no surprise that often medication is required to try to help them break the cycle. Like metformin is a medication which reduces insulin resistance, improves insulin sensitivity. Supplements like berberine, minoxidil, anything which helps you lose weight. Ozempic is actually really good medication for PCOS. Weight loss in general, all these things will help. And then you can start going backwards on that snowball. But yeah, there can be this kind of snowball effect, where weight gain causes more inflammation, more insulin resistance, and then that in turn causes more weight gain.
So which foods would you absolutely not recommend for women with PCOS? Like really bad foods?
Yeah, I would say generally, we all know what the really bad foods are, but there are some foods which we don't really know so much about and we should be more mindful of. So the ones we all know about, we know that if you go to KFC and get that deep fried stuff, that's bad for you. Very calorie dense, high in saturated fats. My wife got us some blueberry and lemon muffins yesterday, and from Costco, and on the label it said high in saturated fats, high in salt, sodium, and high in sugar. So there you go. It had a bit of a health halo, lemon and blueberry, but it was actually really unhealthy. And so often when you look at the label, it tells you that it's unhealthy. I mean, it's like, these are generally very addictive, hyperpalatable foods. So it's very difficult to not eat these foods. But yeah, so deep fried foods are bad for you. I would say red meats generally are bad for you. Solid fats like butter, ghee, lard, these are very calorie dense and have been shown to increase liver fat, increase belly fat, visceral fat. Also refined sugars, so where the carbs have come out of the native state and turned into white carbs. Anything coming out of a bakery, white rice, cakes, croissants, Timbits, donuts, the whole lot. But also stuff made from white flour like white breads, white naan, white chapatis, white tortilla wraps. And then even white rice is not the best. You'd be much better off having quinoa or millets or maybe some brown rice and quinoa mixed or something like that. Because now you'll have people, trying to shoot me down saying, well, hold on, Dr. Rawat, I can have my white rice with broccoli and asparagus and salmon. Now, is that still unhealthy? Of course not, right? The overall plate needs to look healthy. However, what I get my clients to do is track their calories, but not only track their calories, I get them to track their protein intake, their fiber intake, and their overall nutrition intake. It's like a game. You've got, let's say your target is 1400 calories. Now your target for fiber, let's say is 40 grams. So let's say your target for protein is 100 grams. Now, within that calorie limit, you need to get your fiber and your protein targets. And what people find is, if you've had 2 bowls of white rice, which is about 300 to 400 calories, it gave you almost zero fiber, maybe 1 grams. It gave you almost zero protein, perhaps half a gram or something. Best of luck getting the rest of your fiber and protein with the remaining 900 calories, and you can just have 1 cookie from Costco and there you go, you blew it. You got no fiber, no protein, and you just got your calories. So technically there is nothing wrong with white rice. You could have the broccoli, asparagus, and fish and you'll be all good. However, if you start tracking and you have a calorie, fiber, and protein target, things like white bread, white rice, which are empty calories, foods like Coke, having a 150 calorie can of Coke instead of having a Diet Coke. And that kind of Coke gave you no fiber, no protein, gave you no nutrition whatsoever, and you just went 150 calories on your calorie target. So empty calories, which means calories which give you no nutrition and no satiety, will not help you get to your targets. And that's another reason why quinoa or millets or brown rice would be a better pick than white rice.
What would be your suggestion for the diet of someone on PCOS with a low budget?
I'll just make some general, because I've already answered this question twice, Kush. So I'll kind of just make some general points about budgets, okay? This is actually a really good question. This could be an essay or a talk in itself, because one of the main reasons that people from more challenging socioeconomic backgrounds struggle more with weight is because the way food is manufactured in factories and overall how agriculture has moved in the last 20-30 years. The foods which are the cheapest are the most calorie dense and the most unhealthy. And so if someone is having food on a budget, it's very difficult to be healthy at the same time. Your budget burger from McDonald's could be, I don't know, $3-4, and that grilled chicken shawarma plate is going to be like $20. So if you're on a budget, you're more likely to have the McDonald's than have the shawarma plate. Saying that, there are some things I would like to impress upon all of you. Well, I'd say 2 things. 1, frozen food is amazing, it's excellent. All kinds of frozen fruits, I get them from Costco, mixed berries, blueberries, mango, raspberries, all of them, put them in the freezer. They have the same nutrition content as fresh fruits. So if you're having a smoothie in the morning, you can, defrost some and throw them in. If you're having a Greek yogurt, you can defrost some and throw them in. And this is a relatively inexpensive way of getting your fruits in. And not just fruits, your vegetables, frozen peas, frozen corn, frozen edamame, all these things. If you're having something relatively unhealthy, like you're making some, let's say, white rice, throw in some edamame or some corn or some peas. You'll end up increasing the nutrition value of that food. Make it a bit more of like a pulao rice instead of making a plain rice. So things they put in the freezer: corn, peas, edamame, all kinds of frozen fruits. Amazing and quite reasonably priced. The other thing I'd say is tinned food. I know we all worry about mercury and preservatives and all that. If you're on a budget, it can be a lifesaver. And as long as you're careful about a few things, and you do have to do a bit of research, they're actually quite good. They're really quite good. Beans, for example, chickpeas, these are really good sources of soluble fiber. You can open a can. You don't necessarily have to do it like your mother did it. You can open a can. Tuna, fish, all these things can be fairly cheap and fairly convenient ways of getting your protein in, getting your fiber in. On frozen, you can get frozen broccoli, you can get frozen cauliflower from Costco as well. So these are all easy ways and fairly affordable ways of getting to a healthier diet. I got some protein wraps from the supermarket. These are high protein, high fiber wraps, so much better than your standard tortilla wrap. And someone pointed out to me, it says it may contain sulfites. And what I want to impress upon you, if someone's got a health problem, let's say someone's diabetic or pre-diabetic or has blood pressure or polycystic ovaries, they really need to get to a situation where they lose belly fat. They need to be in a calorific deficit. If a food, whether it's frozen fruits, frozen vegetables, canned beans and tuna, is helping you get to that aim instead of doing Uber Eats, then that's a win. That's a huge win. Sure, that tinned beans might contain too much salt. You might have to look for something tinned which contains less salt, and you can find those. If you're having baked beans, you might have way too much sugar. But you can find unsweetened baked beans as well. You do have to look at food labels, and you do have to be mindful. If you have high blood pressure, you want to be really careful with your salt intake. So, of course, there are some things. If you're having tinned tuna more than 4 times a week, you might end up with too much mercury. So you probably want to keep it at 4 times a week or less than that. But these foods can be fairly inexpensive, and they can really help you move towards a healthier diet.
What about any antioxidants or minerals or micronutrients that should be more focused, or that we should be more focused on for the diets of those with PCOS?
Yeah, so micronutrients and vitamins are primarily what you find in vegetables and fruits. So if you have plenty of vegetables and fruits, generally you'll be fine. Whether it's zinc, magnesium, anti-inflammatory agents, antioxidants, phytonutrients, flavonoids, plant polyphenols, all these things are within fruits and vegetables. Also, seeds and nuts are high sources. Of course, omega-3, olives, avocados, seeds and nuts, all that kind of stuff. Saying that, if someone's got a particular health problem and they want to just take out a little insurance policy, no shame in just having a supplement as well. For example, on my blog on healthgroupcoaching.com, I have a standard multivitamin which also contains certain anti-inflammatory agents like lutein, choline, and lycopene. Also, on my blog, I have a certain plant protein powder which contains a whole bunch of vitamins, minerals. It contains 1.5 CFU, which is colony forming units of probiotic as well in that protein powder. So every morning I have a smoothie. I put in a scoop of that protein powder as well. And so, yeah, there's no shame in taking some supplements as an insurance policy as well. But generally speaking, if you're having plenty of fruits, vegetables, fish, seeds and nuts, lentils, legumes, soy, you'll be covered. Yeah.
I know you already said that you talked about this on your website, but would you be willing to go more in depth on how red meat can cause cancer and inflammation? Because PCOS increases the risk of endometrial cancer, and it's often also linked with long-term low-grade inflammation.
That's correct. So if you were to, one treatment of PCOS is, I'm just going to open up a website actually. One reason that clients with PCOS can get endometrial cancer is because they don't have a period, which means unopposed estrogen having an effect on the endometrium or the endometrial lining, and that causes chronic hyperstimulation of the endometrium. So being on a oral contraceptive pill, which will allow you to have a period once a month or so, is actually something which will protect you from endometrial cancer as well, because it will not allow unopposed estrogen. Generally, we recommend that a female should menstruate at least once every 3 months. So those females could take a pill once every 3 months, or take a pill continuously and have a period once every 3 months. And that is a safe level. If you're going much more than that, then there is risk of unopposed estrogen, which can then lead to estrogen hyperstimulation. I'm just going to open up my website real quick, guys. Since you were asking, so this is my website, healthgroupcoaching.com. What was the question again? Forgot the question. I think the question was about, someone's got to remind me what the question was.
Sorry, I was wondering, because you mentioned earlier that red meat can cause
Yes.
cancer and inflammation. So I was just wondering if
That's
you could
right.
go
Let's have a look at the blog. So let's have a look. I've written about 65 blogs so far. Here it is. Let me see if I can make it a bit bigger for all of you. So red meat was classified by the WHO as a carcinogen. Processed red meat is a group 1 carcinogen, while unprocessed red meat is a group 2A carcinogen, which means probably carcinogenic, while processed red meat, things like sausages, hamburgers, are definitely carcinogens, confirmed carcinogenic. You can read the report from the WHO on this link here. So what are the reasons that red meat might be causing cancer? So I mean, all of you know that red meat causes colon cancer, that is a well-known fact, and colon cancer is one of the most common cancers we have, but there are probably other cancers linked to red meat as well. So one mechanism is something called Neu5Gc. So what happens with Neu5Gc is, think of it this way. That mammals, which are red, warm-blooded animals, are kind of your very distant cousins from a biological point of view. Okay, so what happens is, a few million years ago, we were all producing Neu5Gc, but then as human beings, we branched out and started producing something else called Neu5Ac. It's a protein which lines the cell, lines the membrane of our cells. Now, when we eat red meat, then instead of Neu5Ac, we end up getting Neu5Gc, but our body thinks it is Neu5Ac. It gets incorporated into our tissues and leads to this, and then our immune system eventually finds out this is the wrong protein and starts attacking it, and that causes a chronic low-grade inflammation. And many cancers, there have been many studies in which they showed that cancer cells tend to have a higher concentration of Neu5Gc. And so this is just essentially a mammalian protein which kind of mimics our own human protein, but then eventually when the immune system finds out, inflammatory response or immune system response takes place. Now, this kind of explains to you why you won't get the same thing by eating fish or by eating plants or by eating even birds, because biologically they are further away from us. This is almost like talking about zoonotic infections, just like COVID happened because of a bat, and you can get swine flu from a pig. The reason those viruses and HIV came from monkeys, the reason that we can get viruses and diseases from other mammals or warm-blooded animals, because those viruses are adapted to live inside that mammal. And when humans get infected, a certain strain of that virus might be able to make the jump and be able to survive inside a human and multiply. And that's what's called a zoonotic infection, an infection which happens in human beings but comes from a mammal or from another animal. And so how close you are biologically to what you're consuming does have an impact. For the same reason that you're more likely to get worms and parasites from animals, from red-blooded animals, because they're adapted to warm-blooded animals. If you started eating human beings, if you became cannibals, that would actually lead to more disease. Even certain things have been scientifically proven. For example, there were certain cultures in the past where there was a lot of inbreeding, and there's a significant increase in the amount of genetic chromosomal abnormalities within that. So it's almost like saying biology or nature has a way of telling human beings what is appropriate behavior or what is less appropriate. And according to nature, just like eating a monkey should probably make you think twice, kind of the same applies to a cow as well, because it's biologically kind of closer to you, being a warm-blooded mammal. That's the whole theory around E5GC. So this is what it causes. The next is TMA production. And these are certain red meats which contain a lot of L-carnitine, get converted by the gut microbiome into TMAOs, which are also inflammatory. The kind of iron you get in beef but not in spinach, what we call heme iron, is also inflammatory and collects in the liver and causes inflammation there. Also, there are certain types of advanced glycation and advanced lipoxidation end products, AGEs we call them, from cooking red meats in high temperature, like deep char grilled or deep fried. And just generally, red meats contain more saturated fat, which we know is unhealthy for blood vessels, but also increases inflammation. And inflammation in itself can cause cancer. And finally, there is also myoglobin, which is muscle protein, which can overload the immune cells as well. So, and if you want to read in more detail, you can check out the blog. But yeah, so processed red meat is a class 1 carcinogen, so proven, while unprocessed red meat is a group 2A carcinogen as per the WHO, World Health Organization. Yeah. So I know some of you must be thinking, dang it, I've been having beef burger every morning. You're young, it's very early in your journey, but eventually you want to try to start reducing, and don't make it regular part of your diet. If you want to have it once a week or something, twice a week even, perhaps, sure. Having something in small quantities is not going to cause any significant harm to anyone. But if this is part of a daily diet, if your breakfast consists of sausages, beef sausages, and cornflakes, that's going to be a problem.
Are there any specific biomarkers that you track to evaluate nutritional success in patients with PCOS?
Yeah, in PCOS, there are a few things you look at. You look at hormone profiles. So we're quite interested in their ratio of LH to FSH, because if the ratio is 4:1 or more, then that suggests a very active PCOS profile. If the testosterone is high, then that is suggestive as well. Nutritionally, you're just looking for all the usual stuff. One marker of insulin resistance is a ratio of triglycerides to HDL. Triglycerides is a type of sugar fat. HDL is what you often call good fat. If the ratio is high, which means high triglycerides, high sugar fat, and low good fat, that is also very suggestive of insulin resistance. Then, of course, you look at fasting sugar, you look at 3-month average sugar, the HbA1c, look at general inflammation. I tend to check CRP, which is C-reactive protein, which is an inflammatory marker, in my clients as well. And generally, just looking for overall nutrition. You're looking for the vitamin D, vitamin B12, zinc, magnesium, all that kind of stuff, because that gives you an idea of the overall general nutrition. If I see someone's got low magnesium and low zinc, either they're elderly and they're not absorbing it, or they might be on medication that's not helping them absorb it. And if they're young, then they just have a very, very poor diet. Because healthy foods, if you're having plenty of seeds, nuts, lentils, legumes, soy products, fruits and vegetables, there's really no way that you can be deficient in zinc and magnesium. And so unless you have a major malabsorptive problem, it's probably a poor diet causing those things.
What are your thoughts on intermittent fasting? Like, is it more help or more harm?
Intermittent fasting is actually, I'm a big fan of intermittent fasting. I know it sounds kind of anti-establishment because here I was talking about calories and now I'm talking about fasting. Fasting has benefits beyond just calorie deficit. The primary benefit of fasting is calorie deficit, but it does have benefit and has been shown. You can look up research done by Courtney Walsh. You can look up research done by Dr. Sachin Panda. What they've shown is even in isocaloric studies, which means studies in which both groups, the control group and the test group, both of them had the same amount of calories, fasting has reduced inflammation, reduced insulin resistance. But the type of fasting is extremely important. And what I really believe in is what we describe as ETRF, also called early time restricted feeding. Some people also call it circadian fasting. And Professor Sachin Panda, who's a professor at the Loya Institute in California, he wrote a book on this. What that really tries to explain to you is that we are more insulin sensitive, so we can metabolize our sugars and carbs much better in the mornings than we can do in the evenings. And there's a really good reason for that. Once evening sets in, it starts getting dark, we're getting closer and closer to nighttime. What happens during nighttime? You're naturally fasting. So what's the danger of fasting? Low sugar attacks. What causes low sugar? Insulin. Job of insulin is to push sugar out of your bloodstream into your cells. And so your body naturally makes you insulin resistant at night. So starting from evening time to early morning, you are more insulin resistant. There are also some other causes why you become insulin resistant. You produce more cortisol, stress hormone. It's called the dawn effect. You also produce more growth hormone. All these things can be counter-regulatory to insulin. So what that means is the same meal for breakfast and the same meal for a late dinner will have different effects. The same meal at dinner time will cause more sugar spike and it will cause more weight gain than the same meal in the morning. There have been studies which showed that. There was a study which had two groups of women. One group had 700 calorie breakfast and 200 calorie dinner. The other group had 200 calorie breakfast and 700 calorie dinner. The group which had a heavier breakfast and a lighter dinner, they lost more weight. This was a 2-month study, it was 8 weeks. And then there was another study in which they said, listen, there's no way that you can have an isocaloric study, which means the calories are equal, equated on both sides, and you can have one group losing weight. That's not possible. There's no way they could have been isocaloric. So they designed a purely isocaloric study in which people were not allowed to have any weight fluctuation. If they had fluctuation of weight, then they would give them more calories. But one group had a heavy breakfast and a light dinner or even an absent dinner. The other group had late dinner and heavy dinner. And what they found at the end of the study was there was no weight change because it was isocaloric. However, the people who had a heavy dinner, they had bigger waist size and they had more liver fat and they had more visceral fat. So within the same weight, people with heavier dinners got more belly fat, they got more liver fat, they stored more energy and they utilized less energy. While the people who were having heavy breakfast probably got more weight on the shoulders and other places, hips, thighs, not so much on the belly. So from a metabolic point of view, circadian fasting, which means having a heavy breakfast, having more carbs for your breakfast as well, I tend to say, and then try to have a lighter dinner and perhaps some fewer carbs, more protein in the dinner, tends to be metabolically beneficial. And if anyone wants to go further with fasting, they want to extend their fasting window from, I don't know, 12 hours to 14 hours to 16 hours, do it primarily by bringing your dinner earlier and earlier. Don't do it by skipping breakfast, because breakfast is the time when you can have the most carbs. That's the time when you can have junk food even, because you're utilizing that sugar the whole day. You have the whole day to utilize that sugar. Sugar is the energy currency of your body. And you have something in the body called energy partitioning, which means every second your body has to decide what to do with that energy. Store it, burn it, store it in the muscles, store it under the skin, store it in the liver. The body has to make decisions. If you're having more sugar and more carbs and more energy in the morning, and you have the whole day to burn it off, and remember, the organ which uses the most sugar in your body is actually your brain. So it doesn't even have to be physical exertion. Even studying is going to make you burn sugar. If you're having a heavy breakfast and you have the whole day to burn it off, you're gonna end up storing less at the end of it. Of course, calorie balance is the most important thing, but still, from energy partitioning point of view, studies have proven that you have a more favorable energy partitioning the heavier your breakfast is. The later you eat and the heavier your dinner is, you're kind of hijacking your own system and kind of sabotaging your own system, because all of a sudden you've given your body a huge amount of calories and it's bedtime already, and you're not going to be utilizing it. So your body has no choice but to store it as fat deposits. And so if anyone wants to do fasting, there is benefit, but you want to do it primarily in a circadian kind of way, in line with the hormones.
How many clients do you often get with PCOS, and what is the percentage of your clients that struggle with PCOS?
Yeah, it's quite a common diagnosis, polycystic ovary. Just like these other metabolic conditions, prediabetes, fatty liver, pre-hypertension, sleep apnea, these are quite common diagnoses as well. And PCOS is just a female kind of version or extension of metabolic syndrome. And so it's fairly common. The biggest reason that a lot of girls don't get diagnosed is because all of their symptoms are seen in isolation and they're not seen as a one person. Seeing a person as a person is kind of our specialty as family physicians, family doctors. We are trained to look at people as people, but a dermatologist would just look at your acne or your balding. Gynecologist would just look at your periods, or a metabolic endocrinologist would just look at your diabetes, while a leptologist would just focus on your cholesterol. So one of the things about medicine is because it's become increasingly fragmented, and everyone's got their own little super specializations, which can sometimes mean the client is not seen as a whole person, which is really important. You can have someone who just happens to have frequent breakouts of acne, particularly hormonal acne around the mouth, chin area, has excessive chin hair, has irregular periods, is getting more belly fat, has that kind of a more apple-shaped kind of contour than the more like a pear-shaped contour to the body. And if you link up all the dots, it becomes fairly obvious that this is a case of PCOS, but all these things are seen in isolation and not recognized for the constellation that it is. So it's really important to look at the whole person.
So we've talked about diet. So how do you think that exercise will affect women with PCOS, and how does it interplay with the diet?
Well, that's an excellent question. Yeah. So exercise, again, very big part of my program is exercise, and there are various types of exercise, and all of them have particular benefits. The most underrated type of exercise I feel for metabolic syndrome, so I try to highlight it more, not because I think it's more important than everything else, but because of how underrated it is primarily resistance training or building muscle. It's not just for boys, it's definitely for the girls as well. The girls really need to work on building muscle, because insulin resistance happens because of a abnormal ratio of body fat to body muscle or lean mass. non-fat mass. And you need to work on reducing belly fat, visceral fat, but you also need to work on increasing muscles. Because remember, pre-diabetes, diabetes, sugar problems is too much sugar in the bloodstream, and the biggest sink of sugar is your muscles. You can store up to 2,000 calories worth of sugar as glycogen in your muscles. And so if you have larger muscles, you will be able to drain more sugar out of your bloodstream. Not just the size of muscles, but also the efficiency of muscles. So that's what we call the mitochondrial function of muscles. So it's, the powerhouse of your cell, your mitochondria, its job is to process all that energy. And interestingly, while resistance training works on the mass of muscle, things like cardio, aerobic exercises, high intensity interval training, these things work more on the quality of muscles or the mitochondrial function. So they both have the unique roles. But I would say a combination of resistance training with some degree of cardio and possibly sticking in some high intensity interval training really helps with insulin resistance and also the cardiometabolic risks associated with PCOS.
Do you modify nutrition differently for someone that prioritizes fertility versus symptom control?
Yeah, there is a difference, because a lot of the things we use for symptom control, like for example the oral contraceptive pill, make you infertile. So you can't have them both together. So definitely there's actually very less medication we can give to a person who wants to conceive, because a lot of the medications like spironolactone are teratogenic, so they can cause birth defects. We can't use those. Metformin is safe. So metformin is one medication which is safe. Nutrition wise, there isn't all that much of a difference. Nutrition remains more or less the same as we discussed earlier. But when it comes to medication, yes, there is a big difference. When it comes to fertility for women, the supplement which is the most commonly used is myo-inositol. So those foods which contain more of that would be beneficial. The other one which is used is berberine, which is very similar to metformin. It works on something called the cyclic AMP kinase pathway. But nutrition doesn't change that much, while medication does change quite a lot, depending on whether you're trying to conceive or not. The one thing I'd say about it is that for ladies who want to conceive, it's really, really important to get their blood test done beforehand. One of the things which gets me kind of, I don't want to use the word upset. I shouldn't really, as a doctor, I shouldn't be getting upset with my patients. But one of the things which kind of makes me a bit upset sometimes is when ladies conceive and we do their blood tests and they haven't taken prenatal vitamins, they haven't been taking any supplements, and they're like really low on everything, like low on B12, low on folic acid, low in iron. And in the back of your mind, this could have an effect on the pregnancy. You don't say it to the patient because you don't want them to go back home feeling guilty about what they did or anything on those lines. But you want to be nutritionally replete. The time of conception, when the time that you conceive, there's so much happening in your body at that time, and so much of it is nutrition related. We know that if you're lacking folic acid, you can get neural tube defects. We know that if you're lacking B12, that can cause brain problems. We know that if you're lacking omega-3, that can cause brain problems and heart problems. All of these things are well known. It's not really been very well studied what happens when an embryo is deprived of these nutrients. Who knows what long-term effects these things could have. There's so many diagnoses in medicine, whether it's behavioral diagnoses. Recently we had RFK Jr. talking about Tylenol and autism. That's complete BS, by the way. But there's so much which is unknown in medicine, which then lends to all this misinformation as well. But one thing I don't want to see is girls conceiving and not having had done a blood test prior to make sure they're adequately repleted on vitamin D, B12, iron, folic acid, all those essential nutrients. You gotta make sure, because some girls have conditions like celiac disease or certain malabsorptions where they might have a good diet but they still don't absorb those vitamins, and they may need supplements to help them get to healthy levels of those. So it's really important to ensure you're nutritionally replete at time of conception.
You talked about the use of myoinositol. What ratio and dosing do you find most effective, and are there any other inositols you use clinically?
No, I just on my blog I have an Organica brand myoinositol. It's just one tablet once a day, and that's basically it. I know you can get different ratios, you can get different types. The one that I have on my blog is it's a good one. It's an Organica brand, which is a Canadian brand. I'm, you know, where you guys are, you'll probably have different brands of that. But no, I'm not too particular about the brand or the ratio.
You mentioned prenatal supplements. What's the importance of prenatal supplements and why do we need them when we've lived in the past without them before? Or can you eat foods that supply us with those same nutrients?
Yeah, so any female who wants to conceive should start taking prenatal supplements. They need to be taken before you conceive, ideally a few months before you conceive. They contain higher amounts of certain things which you might not get through your diet. So things like folic acid, which can cause neural tube defects. And it contains just generally like a multivitamin, but it contains higher amounts of certain things which you need a bit more of during pregnancy. So I highly recommend anyone who wants to conceive should start taking prenatal supplements first. Even the prenatals are not very good on omega-3, etc. So I often will recommend an omega-3 supplement and a prenatal supplement separately.
Okay, this is a question from Walter McGee. Does timing of meals around workouts matter for someone with PCOS?
No, not really. Timing of meals are quite important. Most people will be very mindful about their protein intake, and the consensus around the anabolic window, which is the amount of time around a workout that you're growing muscle, is around about 12 hours. Probably 6 hours before the workout and 6 hours after the workout is probably your peak anabolic window. So you want to get your protein in during that window if you can, that 12-hour window. People who do a lot of cardio or quite rigorous resistance training will often want to increase the carb intake before the workout. Just do it a bit like a pre-workout to increase their energy and increase the glycogen stores in their muscles. Some people will have a bit of caffeine or whatever as well as a pre-workout. Afterwards, I don't see that much benefit of really stacking the carbs that much, the energy. Once you've done exercise, you need to make sure you keep getting that adequate protein intake. But the carbs for me are more important before the workout, not so much after. Because one thing I like to think of in a circadian fashion is almost dividing your day into muscle building and fat burning. Your body naturally burns fat when you're sleeping. In fact, almost all of us start burning more fat predominantly than sugar, like 3 to 4 o'clock in the morning, because we start running out of our sugar stores that we had with dinner. If you have an earlier dinner and a low carb dinner, you will burn more fat overnight. Also, if you exercise or do cardio after your last meal, you will get through your sugar faster and you will burn more fat as well. So I don't want people to sugar load or carb load last thing in the night, having a whole half a jug of ice cream or something. That is best done in the morning. Like more carbs, more calories in the morning, fuel your exercise. But then once you get to evening, nighttime, you want to start trying to go into more empty mode so that you can go into that more fat burning zone overnight. That's the way I like to kind of time meals for my clients.
Is it true that what is it? The food you consume the hour or two after you work out, that all of that directs to the muscles that you worked out, or is that a common misconception?
No, it does. So the carbs will be used for increasing your glycogen or stored energy within muscles, so you'll have more energy. The protein for 12 hours, 6 hours before, 6 hours after, will be directed towards building more muscle. So there's definitely a benefit. Yeah. The one thing you could do, one supplement you could take on top of that to increase your workout intensity would be creatine, 5 grams a day.
Okay, this is another question from Walter. How do you approach education on food labels and healthy grocery shopping for PCOS? So like just a regular person or a little kid, how would they know? Because obviously they don't know like the big words. So what's your like approach?
Yeah, the same what I said before. I tend to recommend you can break it up into two parts. One part is the food label itself. So fiber to total carb ratio, 1 to 6, 1 to 8, 1 to 10, like kind of a sliding scale. The protein to calorie ratio, again 1 to 10, 1 to 12, 1 to 14, sliding scale. And then the calorie to volume, so calories per 100 grams. Under 200 calories is a low calorie density food. So those are the main things you're looking for when you're comparing items. Apart from that, you can look at the red light system. You've got the red light system, you've got the reds and the yellows and the greens. So high in salt, high in saturated fat, high in refined sugars. Red light, it's not very good for you. If it's high in fiber, it's high in protein, if it's high in omega-3s, it's good for you. So yeah, whether you use a red light system on food labels or whether you use a more technical math-based system, you need to have some basic education of how to recognize a healthy food from a less healthy food. But there's nothing all that specific for PCOS. All people with metabolic syndrome, be it fatty liver, pre-diabetes, diabetes, pre-hypertension, all of them need to be following those same rules.
Okay, so you mentioned like diet and exercise. What about some like common misconceptions about PCOS?
Yeah, one thing I'd like to just highlight about PCOS is that you can't get PCOS without a genetic trait to get it. Same applies to diabetes, to fatty liver, to hypertension. It's not just the weight. It is a combination of your genetics and the weight. And the genetics also make it more difficult for you to lose weight and make it much easier for you to gain weight. So there is all of that. So because I deal with a lot of people trying to lose weight, because that's my whole coaching program, I kind of feel a bit sorry or bad for clients who get stigmatized and kind of unfairly having blame put on them for their situation, and it's really not a fair characterization. A lot of people can be naturally slim, they're literally trying to gain weight and can't gain weight, and the opposite can be true as well. Your family history, your genetics have a role. Saying that, we don't delve on that very much on the program because there's not much you can do about it. We want to be, focusing on things which we can actually impact. And so we do talk about gut microbiome, we talk about resistance training, muscle building, we talk about inflammation, how to reduce inflammation. We talk about an ideal diet, ideal exercise program. But equally understanding that people who have metabolic syndrome and PCOS, they've been given the unlucky cards from birth, and there needs to be an appreciation and acknowledgement of the difficulties that they go through as well. And to an extent that applies to everyone who suffers from obesity. It's it is not. I can categorically say that it is not related to willpower or your character or anything like that. It's very much related to your genetics, to your kind of hormonal profile, your hormonal makeup. It's a very big determinant. And of course, there are things you can do to reverse the situation, but let's not be in any misunderstanding about it. That it's harder for those people. It is harder. It's very hard for those people because of the way they've been designed genetically, and even gut microbiome is not just genetics. It's also epigenetics, which is a whole topic in itself. Like if a female is obese and having an unhealthy lifestyle during pregnancy, she will pass on epigenetic changes to her offspring, which increase risk of obesity and metabolic disease for the offspring as well. So it's genetics, it's epigenetics. It's also other kinds of factors like, if your ancestors went through famine and wars and colonization and all kinds of things, you're going to be more predisposed to storing fat because it's how the camel adapts to the desert, by having a storage hump on its back, and the same happens to obese people. They're more predisposed to storing the fat, even at the expense of feeling tired and lethargic. The body would rather store it because the body thinks there's an imminent starvation or drought or famine that's around the corner because of the experiences of their ancestors over hundreds of years. And so there are genetic, epigenetic, hormonal, gut microbiome, lots of changes which can have an effect. We can try to work hard on all these things, but we need to acknowledge that it's more difficult for these people as well.
You did say that treatment to PCOS is not really similar, really different from other similar conditions. But how do you individualize the treatment for PCOS patients compared to your other patients who do not suffer from conditions similar to PCOS?
Yeah, the first thing, the treatment generally is the same. It is the same. And that's the same for every condition in the world. If you have a heart attack, you have the same treatment. If you get diabetes, you get the same treatment. Everyone gets the same treatment. Individuality comes from the patient. Do you want to have children right now or not, for example? The treatment is different depending on whether you want or not. What is your current baseline exercise routine? What's your current diet like? Are you a night owl? Are you waking up all night and sleeping during the day? That's going to be terrible for your hormones and your circadian rhythm. So the way the treatment will be different is because every patient is different. So when you find out about that client, about their lifestyle, their diet, their circadian rhythm, all those kinds of hormonal factors, and what things they're trying to achieve. Are they trying to achieve weight loss? Are they trying to achieve conception? Are they trying to achieve cosmetic, not losing hair and getting rid of the chin hair? What exactly are they trying to achieve? And so your treatment will change according to that. If there are 3 medicines I could use, let's say a hormone pill, a spironolactone, a metformin, and a Ozempic or a weight loss injection, if that person wants to conceive, Ozempic's out because you can't conceive on Ozempic. If that person wants, spironolactone's out as well because you can't conceive on spironolactone. But if they don't want to conceive and the primary goal is skin, let's say, then which ones would be better for the skin. For example, spironolactone would be very good because it reduces testosterone. Testosterone reduces the oiliness of your skin. That reduces acne. That's why all those bodybuilders who take artificial testosterone get loads of acne. You probably know, and that's why they lose their hair as well, because the testosterone gets converted to dihydrotestosterone (DHT). In any case, so yeah, so the individuality comes according to their baseline lifestyle and according to their needs and what they're trying to achieve. But generally, the treatment is same for everyone.
If you have a family history of PCOS, is there a way you can somehow avoid getting PCOS now that you're aware that genetics might have a play into it, or is it just like permanent in your genetic code and just luck? And if you do have a family history of PCOS, but you don't have any of the symptoms and you regularly get your period, is there a chance you could get it later on in life?
Yeah, so the answer is yes to both of those questions. So the first one, if it's in your genetic code, it is in your genetic code. Even if you have no symptoms, you are still sitting at one end of a spectrum of PCOS, which means no symptoms. Now, let's say as you get older, we tend to become more sedentary, we tend to start over consuming food and gaining belly fat. Then the genetics will start getting more and more exposed. It'll come increasingly to the forefront and you start getting more and more symptoms. Equally, if a person with symptomatic PCOS were to do everything right, perhaps even take medication, perhaps take Zepbound or Wegovy for weight loss, and come on my coaching program, eat all the right things, get on to maybe do a bit of intermittent fasting and have a circadian hormone balanced lifestyle and do everything right, that person could then eventually have no symptoms at all. If you want to check out the testimonials on my website, I have clients. I have a 19-year-old who came to me with type 2 diabetes, with poor control of diabetes. His average sugar was sky high. On my program, he lost about 30 pounds in weight, and now he's got completely normal sugar with no medication. So he is non-diabetic for all intents and purposes. The same could happen to a girl with PCOS as well. But then that guy, he started from a baseline of being quite obese. So in a sense, it kind of made it a bit easier for him, because the more weight he lost, the more chances he had of completely normalizing. While if he had been someone with a higher genetic tendency, say some of those skinny fat people who technically their body mass index is normal, but they just tend to store more fat around the belly, it can be a bit more difficult to get remission in those cases. So you really focus on increasing muscle mass, gut microbiome, inflammation, hormones, circadian lifestyle. You focus on all of those things. But you got to be realistic that if a person is skinny fat, the genetic trait is very strong. That applies to diabetics and pre-diabetics as well. If someone is a skinny fat person, which means their body mass index is technically normal, they just have a bit more belly fat, and that's enough to cause disease, then the genetic trait is very strong. And you can probably help them take less medication, take the same medication for longer, not have to keep piling on more and more medication, but chances of remission are quite low. On the other hand, if someone's got a fairly mild genetic trait and they've become diabetic or PCOS because of being morbidly obese, like a BMI of 35 or 40, for example, then in almost in a good way, they've got more chance of going into complete remission. So because if they lose sufficient weight, generally speaking, everything will normalize.
Thank you.
I think maybe one more question. What gaps currently exist in PCOS research or awareness?
Yeah, so of course there are many cellular pathways, the GLUT pathways, which is glucose transporting hormones and enzymes, and other kind of signaling pathways which get affected by PCOS. These are very biochemical, cell level kind of things. Generally for metabolic syndrome PCOS, who knows, one day there might be CRISPR technology or what they describe as DNA snipping technology, where you'll be able to snip something out of your DNA, and then your children won't have that tendency, or you might even fix yourself by fixing your DNA. One day that might come. I can imagine there potentially be side effects as well and risks associated. But yeah, for conditions which are very genetically predetermined, one day we could have CRISPR type DNA snipping technology, which chromosome snipping technology, which takes away that defect. So that would be very exciting if that happens.
Okay, so I think it's 7 o'clock, so we can end it here. Thank you so much for coming.
You're welcome. If you want to check out my YouTube channel, anyone who has any problems with weight gain, is Dr. S. Rawat, Reverse Metabolic Disease. That's the name of the YouTube channel. You can find me on TikTok as well. Just to look for Dr. S. Rawat. And you can check out my blogs and my website, healthgroupcoaching.com.
Thank you very much.
Take care, everyone.
Thank you so
Bye-bye.
much.
Okay.
Okay, so hello everybody. I am Dr. Rawat. I am one of the family physicians in Toronto. I'm trained in the UK and I work as a family doctor in Toronto. I have a special interest in women's health because I see a lot of women as a female, physician. So you end up seeing a lot of women, right? Girls with issues related to periods and often polycystic ovaries. So we're going to talk about polycystic ovary syndrome today, and that's what you guys are interested in, right?
Yes.
Okay, cool. So I'll jump straight into it because we only have half an hour just, and I'll share my screen with you guys so you can see a couple of slides that I have made for you. Let's do that here. Share screen. Here we are. Okie dokie. So we're talking about polycystic ovary syndrome, which is one of the most common scenario we see in family medicine, or any female physician or any doctor would come across, I think, on clinic basis. Polycystic ovary is pretty common. It's present in about 6 to 13% of women. We call it endocrine pathology. So even though it's related to women's health, it's very much related to hormones, right? Endocrine means hormones. So it includes hormonal dysregulation and a lot of follicles in the ovary. Very common, 13% is a big number, isn't it? That a lot of girls can have issues related to that, or women can. The mechanism is not very well understood, that why this happens in women. It's not been exactly found out that what causes it, but there seems to be a relationship between the brain and your body, how it functions. The link between your brain and the ovaries, how they function, and that's related to the hormones. So you have a structure called hypothalamus in the brain, and that releases the hormone called GnRH hormone. That works on the pituitary gland, which is also in the brain. So we have hypothalamus at the very top, and then we have a pituitary gland somewhere down there, and there's a link between the two, which determines the exact hormone content we have in the body, right? So GnRH, it causes, so when we have the polycystic ovary, the GnRH is hypersecreted by the hypothalamus, which is like the god of the brain, you can call it, and it will send a signal to the pituitary gland, which secretes excessive LH hormone. So LH hormone is the guy that's causing the bit of problem here, and it's going to go on work on adrenal gland and the ovaries, and they both secrete more androgen, right? So we know that the problem here is the hormones. So the hormones that is mainly contributing to all the symptoms is testosterone, which is a form of androgen, right? Now, interestingly, this high androgen or high testosterone can also lead to insulin resistance. Insulin is a very important hormone that's responsible for controlling the sugar, right? We know that. But it also does a lot of other things. So when we have excessive insulin in our body, too much insulin going around, There is an insulin resistance. That means the insulin is not doing what it's supposed to do. It just floats around the body free, which in turn causes high androgen levels, right? It also makes you high risk for diabetes because insulin is there, but it's not working. It's not doing what it's supposed to do. So there's a link between polycystic ovaries, hormone dysregulation, and also diabetes. So you might have heard that people who have polycystic ovaries are actually high risk to get diabetes. They also gain more weight because, excessive insulin also cause increased weight gain. So it's like all cluster of things that happen when somebody has polycystic ovaries. So move on to the next slide. Now, what it causes, basically what leads to polycystic ovaries. So it's a combination of two things. It's not just what happens in the ovary, but it's also the impact of that on the body, which is the hormonal changes, right? We don't know what causes polycystic ovary. Exactly, there's no confirmed, it's not very straightforward that why this happens, why some people have that and others don't, right? Some people have polycystic ovary, others don't have it. There is a genetic factors though, like you see parents have it, sibling have it, and you can have polycystic ovary too. So there's a strong genetic link here. Which is contributing to about 70% of causes. So 70% of polycystic ovary is likely genetic, but we don't know which gene causes it. So as I said, it's not very clear yet. There's high androgen level or high testosterone level. And what high testosterone does, it causes acne, increased hair growth, so like almost male pattern, right? Androgen is a male hormone, testosterone is a man hormone. And what that causes is increased hair growth, acne, because when you have too much testosterone, it blocks your pores in the skin, and you get the blocked skin ducts, which leads to acne. Causes the weight gain, as I said, because there's too much insulin flowing around, which causes the weight gain, and it also causes high glucose level, making you high risk to get diabetes. It can also happen in normal weight people. We think people who are overweight are more likely to get it, but people who are normal weight can get it. There's high risk for, as I said, type 2 diabetes and irregular periods. Of course, we know that what polycystic ovary does is it causes the irregular periods, right? So women tend to get, normally we should have a monthly cycle, but what happens in women, they don't get monthly cycle. They tend to get cycle, let's say, every 3 months, or even if it happens, it's just a little bit of bleeding happening here and there. And also it causes anovulation. That means even though, women should have monthly egg release, right? Ovulation, which doesn't happen here. So that's also one of the things. Next thing is, how do we diagnose it? So diagnosis is based on, it's called Rotterdam criteria, which is based on your hormone levels. So we check your testosterone level. You'll notice the LH is high. Remember in the first slide we talked about LH. So what the brain hormones at the top will do, GnRH will increase your level of release of LH. This LH causes increased testosterone or androgen. So there'll be high LH, high testosterone, mild rise of the testosterone and prolactin levels. Prolactin is another hormone that's also part of the pathway. So when you have more androgen, prolactin goes up. So when women come to me and they say, okay, we have a irregular period, what do we do? First thing I do is do their blood test, right? Check for testosterone, check for prolactin, check for, LH hormone, FSH and LH2 female hormones. They're the most important ones, right? Check for those. And I also check for thyroid, because sometimes thyroid problems can look very similar to polycystic ovaries and they can lead to irregular periods and all those things. So we check all those hormones and then we ask them about the periods. So, okay, tell me how your period's going. And they'll say, okay, the periods are irregular. We're getting a cycle once every few months. Or they'll come and say, okay, I had a bit of bleeding, but it was so tiny and so small that wasn't quite my normal cycle, right? So they'll have irregular period, every 2 month cycle or every 3 months bleeding, something down those lines. Then you do an ultrasound scan. Okay, so there's 3 things we are looking for in rotoderm is hormones, your period cycle pattern, and another one is your ultrasound. So in ultrasound, they see a lot of follicles. So ovary has follicles. We have small follicles in ovaries. But you notice that if you have polycystic ovaries, these follicles are increased in size. These are about 2 to 9 millimeters follicles in one or both ovaries. And the ovary volume, so radiologists, when we send patients for a scan, they actually tell us, okay, we have so many follicles and this is the volume of the ovary which is increased due to so many follicles, right? So those are 3 things, the hormones, your history, and your ultrasound. 3 things. Next thing is, what do we do about it? How do we deal with this, right? So what you're going to do is you're going to ask the patient to lose the weight. So when we lose the weight, it somehow has a benefit on the body. If you lose about 5 to 7% of weight, it will restore the ovulation. About 80% of women, they will have improvement of the hormones. I know it's a chicken and egg situation. You say, okay, polycystic ovary is causing the weight gain, or is weight gain contributing to the polycystic ovaries? Difficult one, isn't it? But there's certainly, if you lose weight, about 5%, your ovaries start to get back to normal. And what that does, it reduces your testosterone hormones and it reduces your insulin level. So that, remember that insulin causing all the problem, triggered by the androgens or testosterone, gets fixed by weight loss. So I recommend weight loss for all my patients before I put them on any medication. What medication you can give them? So let's say if they don't like the idea of not having a period, let's say for many months, right? You want them to have a period. Everyone should have a period once every 3 months at least. So you can put them on birth control hormone, which is contraception, birth control, and that will induce the bleeding, hopefully, at the end of it. It will reduce the secretions of the gonadotropin hormone. Remember the one we were talking about earlier, so GnRH, RH hormone. That will be reduced, and that will, to an extent, might fix the problem. It might give it a restart, to the whole thing. It might happen. So we say that when the GnRH hormones are released, and there are some other pathways like sex hormone binding globulins, they are taken care of, and it's a complex medical thing, so I won't go into that. But just the hormones are improved with birth control pill, and it works like a reset button. And also you want to give a female a period every 3 months at least, because not having a period is not good. So why do we need a period? Okay, why do we need a period? So of course it might be that after giving you a cycle, after having a regular cycle pattern, you ovulate better, your hormones are well regulated, but it also reduces the risk of endometrial cancer. So women who have polycystic ovaries can be high risk for endometrial cancer because the lining of uterus is thick. It's not shredding every month, right? So it's a thick lining and you don't want that. So therefore you could give them birth control. Yep. And metformin. Now this is a drug called metformin, which we use for diabetes. That somehow may help or may not help. There's not much evidence, but for some women it helps. What metformin does, it reduces the sugar level. It also reduces insulin resistance. Remember, insulin resistance was a big problem there, right? So it reduces that too, because insulin resistance was contributing to a lot of this as well. So we want to reduce that. So metformin actually can reduce insulin resistance, and it can bring your androgen back to normal and cause periods to come back. Now, some women are annoyed by the side effects of testosterone, right? So they have facial hair, they have weight gain, they also have acne. So you can take care of that by giving them finasteride, which is anti-androgen drug. Also, there are another drug called spironolactone, and these all work on the androgen receptor that say, okay, too much androgen going around, causing all these funny things happening, giving me hair and, acne and all. So let's block those receptors. So we give them certain drugs to do that, right? Okay, then we have, when you have somebody with polycystic ovary, what extra test you will do for them? So you want to make sure that, okay, this is polycystic ovary and nothing else, right? It's not something else going on like a thyroid problem or a pituitary problem or something else, right? So you can do a thyroid test for them. So when they come in for a blood test, just do a thyroid. So make sure, so high thyroid, thyroxine hormone. So you have a gland in the neck here called thyroid gland. It releases a hormone called thyroxine. Now that thyroxine can interfere with your periods if it's low or high. So when somebody comes in and say that, okay, I have irregular period, you want to make sure that the thyroxine is fine. So you check for that. Often these patients can be overweight. So you want to make sure that cholesterol is good. So you do the cardiac risk. That means you check their sugar is good, your cholesterol is good, you're not overweight and all these things, right? So you want to play a little bit extra careful here. You check them for diabetes. You sometimes check them for more hormones. So if you think, okay, I'm not so sure this is polycystic ovaries. Is there something happening at a higher level, like at the brain level, right? Let's say pituitary is playing, there's a gland in the brain that's causing the problem. So you want to check some specific pituitary hormone, or you want to check some hormones related to the gland called adrenal. So, there are sometimes a lot of things that could be contributing. So you have to rule those out, right? Although the common cause of having irregular period is often polycystic ovaries. In women who are getting older, right, 45, 50, when they're about to close the periods, what we call as menopause, they can also have irregular periods, right? So their cycles can be all over the place as well, quite possible. And what you do in that case, you check for FSH, LH hormone again, just to see that are they actually going close to menopause? That's why they're stopping the periods, right? Or they're having irregular period instead of actually having the polycystic ovaries. So I would say polycystic ovary is more young age problem rather than an old age problem, although it can happen anytime. Yeah, so keep those in mind. So those are the things. And then I made this last slide. Let's see what that is. I think, we've talked about that. So this is my basic approach to polycystic ovaries. There's no surgical management for these things. They're more or less managed more clinically with medication, lifestyle, risk factors, modification and all that. We have about 10 minutes. So do you have anything specific you want to ask me or ask me a question?
We do have some questions.
Mm-hmm.
So our first one is, what about the mental state? Like, what are some, how does it impact your mental health, and why is it
It's an excellent question. Yeah, that's a fantastic question. You know why? Because if women have or girls have symptoms related to polycystic ovaries, then it could impact them in various ways. So androgen itself can change the moods. So hormonal dysregulation can affect the moods. Androgens can make you feel, depressed, or there could be anxiety element, there could be mood fluctuations, etc. That's the direct impact of the hormones. But then there is an indirect impact in the form of, you have acne, let's say, a young girl with a lot of acne, not having cycles, not having periods, that can impact you psychologically indirectly, right? Also, when you see that everybody around you is having a cycle monthly and you're the odd one out, suddenly that can play in your mind too, right? That why is that happening to me? Also, let's say when women are older and they're planning for kids, and that's when it really interferes with the fertility, because if you don't have a period regularly, or if you don't have an ovulation, which is pretty common in polycystic ovaries, that you don't get any egg release, the chances that you may not have kids, right, until you fix the hormones and bring your cycles back to monthly cycles, So that anovulation is a problem. A lot of the time, women who are having fertility issues due to the anovulation or not having the eggs released in polycystic ovary syndrome, we induce that by giving them certain medication like letrozole is one of the drugs we give to patients, but they again have side effects, right? So there are a lot of psychological impact that can come with it, a baggage that can come with it. Also, if it's causing weight gain for you, right, a young girl getting the weight gain because of polycystic ovaries, then again you say that, okay, it's not a pleasant thing to have, right? So a lot of things can come into picture.
We have another one. Why do you think PCOS is underdiagnosed and underdiscussed?
Yeah, I think there is still lack of awareness. More than lack of awareness, it's, girls opening up to their moms, right? So like your age group, I'll say, if you do not tell your mom that I'm not having a period or tell your family doctor, you wouldn't know, right? A lot of time you think, okay, this is quite normal actually. And when you start having your periods at the age of nowadays, it's anything from 10 to 14 years when you start getting your periods, you initially do get hormonal dysregulation. So a lot of the girls will have one period at 10 and it doesn't happen till 12. So they're not sure, right? So there's a lack of awareness plus open discussion. You're hesitant to talk about it. So speaking to your parents or family physician, making sure that you tell them how you're feeling about your cycles and whether they are like you're getting enough bleeding. Sometimes you can get tiny drop. Okay, you say monthly, a little bit of bleeding. That's not quite normal, right? So yeah. What other questions? Any other questions?
Can I ask one question?
Yes,
Yeah,
please.
go ahead, Reagan.
What are some misconceptions about PCOS? Like, what do some people get wrong?
Great question. What do some people get wrong? I think sometimes one is sometimes not being aware that what it is, right? A lot of the time you start to question yourself that, hey, what's happening to me and all that, right? That am I the problem, right? You think, oh, is that because I am overweight? That's what's happening to me. Well, it could be partly the case, but that's not the only thing, because you see a lot of overweight women who get polycystic ovaries, but there are a lot of them who don't. There are a lot of slim girls I see have irregular periods or polycystic ovaries, and some don't, right? So it's like you ask yourself that why me kind of thing. So as we said, there's a lot of genetic aspects to it, plus somewhat weight as well. So that's one thing. Sorry, what was exactly the other thing you asked me? What was the specific question?
The specific question was, what are the most common misconceptions?
Yeah,
about
more common
PCOS?
misconceptions. Yeah. So one is, of course, presuming that being overweight is the problem, right? Because there's genetic aspect to it, right? That's one thing. Second misconception is that awareness, that how common it is. That it's just 13% is quite common, isn't it? So knowing that it's actually quite common and putting that keeping that in mind when you see a young girl with those issues. Yeah. Does it answer your question? Yeah.
Yes.
Okay.
What are long-term health risks that are associated with PCOS if it's not properly managed?
Very good question. Excellent. So as we talked about increased risk, you guys, all three questions were awesome. So increased risk of diabetes, we know that, because there's insulin resistance. Insulin resistance will also cause weight gain. We know that. Also, gestational diabetes. So even women get pregnant and they get the diabetes during the pregnancy. That's quite common. Increased risk of cardiovascular disease. Isn't that awful that you get the cardiovascular disease because of it? Because you gain more weight, you're more likely to get high cholesterol, you're more likely to get high sugar. You may not get pregnant when you plan for family. There could be infertility, right? That's another one. So there's a baggage that comes with it, isn't it? Skin issues. You can have spots on the face and you want to have a nice clean skin. So that's another one too. Yeah, any more questions?
I have a question. What
Yes.
advice will you give to someone who has just been diagnosed with PCOS?
Yes, so one thing I will focus really on the lifestyle, right? Because you have this hormonal pattern which is unhealthy in a way that is causing increased insulin levels and so on. So you want to tell them that, hey, look after your weight, because reducing the weight, as we said, is going to, if you drop the weight by, I said 10%, right, or 12%, it might actually fix your ovaries. So it's a chicken and egg situation, whether the polycystic ovary causes weight gain or weight gain causes polycystic, but certainly there's a good evidence that if you lose weight, it can improve your hormones.
Okay, thank you.
Yeah.
What are some common misconceptions about PCOS?
Common misconceptions?
Mm.
I think, as we said, one is people think you are the one, you're doing something, that's why it's happening, right? Like being overweight is one of them. Or, those things, people say, okay, maybe you're having too many chocolates, or mom will say you will having too many, unhealthy foods. That's why there's hormone issues and all that. So it's a combination that you have to be aware there's a hormonal dysfunction or dysregulation, which is causing a lot of problems. Seeing it as a condition on its own is very important. Yeah.
So we know that PCOS, like you don't always have cysts on your ovaries when you have PCOS. So
Yes.
what are the other ways that you can diagnose it?
So 3 things, as I said, Rotterdam criteria. One is doing a hormone test, looking at the ovaries looking at your ovaries, and one more was so ultrasound, hormone profile, and the symptoms. 3 things to look at to make a diagnosis. You can have somebody who has normal ovaries. It doesn't show polycystic ovary kind of follicles, but they can have a hormones indicating that, yes, the testosterone is high, androgen is high, you probably still have polycystic ovary syndrome. Yeah.
And what like long-term health risks are associated if it's not managed properly?
Yeah, so
Like,
as I said, for infertility, increased risk of diabetes, cardiovascular risk, increased weight gain, all these things. Of course, psychological impact too, right? When you have all those things happening to you.
Why do you think PCOS is underdiagnosed and under-discussed?
It's just lack of awareness. I think still people don't know a lot. We don't talk about periods as commonly, right? There's a bit of hesitation, isn't it? That we say, okay, this is something, okay, it will happen. I didn't get period for 3 months. That's okay. We'll come back in 3 months. And that's the, talking about periods, talking about acne and talking about how you're feeling. It's important to you with your family member, mom, or your doctor, being more open. Yeah.
I have a question. Women with PCOS, do every single one of them struggle with infertility, or is it varied?
Not always. So PCOS can go through phases. Sometimes you see a woman can have actually a proper 6-month cycle. Everything is regulated. And after 6 months, suddenly they don't have a period for 3 months or 6 months. So it can go through phases. They don't always have infertility. During the time when they have a regular cycles or ovulation happening, then you will conceive, right? And the times when you are not releasing the egg, let's say 3 months, usually egg doesn't get released if you're not getting a regular cycle. Every month, if you're not, like, let's say you're having period every 3 months, 4 months, or your bleeding is just tiny bit, chances are you're not ovulating during that time. Let's say you lose a lot of weight, you lose 7 kgs weight, your hormones come back to normal, you start getting monthly cycle, chances are you're ovulating now, and you could get pregnant, yeah.
Would you say that PCOS symptoms might get overlooked as just like period problems?
They can be, absolutely. Yes, therefore the awareness is important. Like this discussion or, amongst the youngsters, it's useful, or anybody.